If you've never heard of Amantadine, you are not alone. This medication started life as an antiviral for the flu. Yes, really. And then carved out a niche in Parkinson's treatment. But over the years, I've learned it may also offer real help in mental health, especially for people dealing with various symptoms of ADHD, irritability, mood dysregulation, anxiety, or OCD. You might also see Amantadine under brand names like Simitrel, but today it's mostly prescribed in generic form, so I'll refer to it as Amantadine. And while it's not FDA approved for psychiatric use, I've seen it make a meaningful difference in select patients, especially when standard medications just aren't working. Let's talk about what Amantadine does, how it works, who might benefit from giving this under-the-radar option a try. So how does Amantadine actually work for things like ADHD, OCD, or irritability? It's not a stimulant, it's not an SSRI, it's not an antipsychotic. Amantadine has a unique two-pronged effect in the brain. First, it blocks NMDA receptors, which helps calm down excessive glutamate activity. Those are a lot of fancy words, but what that means is it actually puts brakes on the whole brain, slows everything down, but not in a way that's sedating or in any way causing brain fog. It helps with people who are having too much activation in various neurotransmitter systems. Second, Amantadine works by directly boosting dopamine transmission, especially in the brain's prefrontal cortex, the area responsible for attention, motivation, self-regulation, emotion control. That's one reason it can help with focus and anger concerns. Some researchers also consider it neuroprotective. What that means is it may help protect brain cells from overstimulation, from breakdown, which is why it often shows promise after brain injury as well. So when you put all this together, you get a medication that helps regulate mood, improve focus, lower OCD, and possibly even aid recovery after a traumatic brain injury, all without relying on traditional stimulants in ADHD or antidepressants in OCD or sedating antipsychotics in people with anger concerns. Now, side effect-wise, I rarely see any side effects when starting Amantadine, but here are the top 3 most common side effects in research, and I've seen it in select patients, let's say 1 out of 50. Nausea or mild stomach upset, this is usually transitory, it doesn't last long. Some will complain of some dizziness or lightheadedness, especially when standing up very quickly from a seated position. Now, when I see restlessness or significant insomnia, I am a little bit hesitant to go up higher. If someone's getting actually more irritable or, God forbid, gets manic, it's obviously not a good fit at all. So this should be used with caution in someone who has true bipolar disorder or has a strong family history for bipolar disorder. Now, like I said, these side effects are very, very uncommon, but I've created a free handout in my Mind Vault at drdaviddanish.com. Please go there to look at all side effects before you talk to your practitioner about trying Amantadine, just so you're fully aware. Another consideration in terms of how it's cleared. Amantadine is cleared through the kidneys, so if you do have impaired kidney function, also consider either starting a lower dose or avoiding this medication. Amantadine should not be used with live vaccines. Some examples of live vaccines are MMR or chickenpox. And the reason for that is because Amantadine kills viruses. If it kills those live viruses before your immune system has a good enough response, in other words, it hasn't made a strong enough response to those live attenuated vaccines, then there is no point in getting the vaccine. And because of overdose risk, especially in children or people of smaller weight, it must be stored safely, out of reach, and locked up in those who may either accidentally take it out of curiosity, such as a young child, or those who have suicidal thoughts or actions. Now, I rarely use Amantadine as a first line or even second line treatment. It's also used very rarely as a standalone treatment. But when I do add it on, usually for ADHD, DMDD or irritability, OCD, or mood instability, I find that subsets of patients respond really well when they have not responded so well to many other classes of medications, such as those who are too sensitive to stimulants or the side effects of antipsychotics, or who have tricky blends of symptoms that don't fit neatly into one category. In ADHD, for example, I'll consider it when a child can't tolerate methylphenidate or amphetamine stimulants due to appetite loss, or they're causing too much irritability or too much anxiety. It's not as potent by far, but it's often more tolerable, and the dopaminergic plus glutamatergic action can give a smoother lift in attention and emotional control for some. I use it in some cases of DMD along with something called trileptal or along with something called lamotrigine. And when it's combined with trileptal, that's called the Matthews protocol for DMDD. And I have a whole nother talk on that. I also use it for OCD in patients who failed so many other options to try to lower their OCD symptoms. It's also interesting in some of my patients who have histories of traumatic brain injury that are leading to impulsivity or anger, and it's very helpful for some of them. It helps jumpstart cognition in some cases and reduce their agitation. In terms of dosing, I always start low, which is true across all medications. I usually do 25 milligrams each morning and then increase by 25 milligrams every 4 to 7 days to get to a typical goal dose of either 100 or 150 milligrams daily, and this can be increased to twice a day if it's not lasting through the day. Now, that said, be careful, don't dose it too close to dinner time or nighttime because we don't want to cause insomnia. In younger kids, I might max out at 100 milligrams total per day. In teenagers, I might go up to 200 or even 300 milligrams per day total, again, divided into 2 doses depending on their age, symptoms, weight, tolerance. In adults, we might get as high as 200 milligrams twice a day, or even in older teens. It usually comes in 100 milligrams capsules, so to get to those lower doses, I often have to use a liquid preparation. Now, another important note. This is not a take it as needed. It's not a PRN medication. You will see real results when it's taken every day and given a few weeks to kick in. Benefits build gradually, not instantly like some other medications. So, Amantadine, not always a magic bullet, but for the right person, it can be a real game changer, usually with minimal side effects. If you want more detail on how to use it safely, how it stacks up against other medications, or how to manage some of the tricky side effects, head to the Mind Vault for a free resource at drdaviddanish.com. I've packed the Mind Vault with charts, comparisons, and real-world strategies across all disorders, and I'll put that link in the description. Please also subscribe, share this with anyone else who you might think it's valuable for. It helps me get the word out there, which is my ultimate goal here.